over in the den now with Dr. Khan from Wasatch Pain Solutions, and we're talking about what you do to actually manage people's pain out there. I know so many struggle with this. Tell me about Wasatch Pain Solutions.
So Wasatch Pain Solutions is a pain and orthopedic clinic, and what we do normally is pain management treatments, and now we're moving into the world of orthopedics and trying to provide care so that patients don't need surgery.
So you are the only Regenexx provider in our state. What does that mean?
Well, that means that I'm the only physician in the state that's taken the time to do the research as well as the actual training appropriate to get to the level of care that we need for this type of field that's so new. It requires several hundreds of hours of training and levels of training. So in order for you to be a provider in the Regenexx network, you have to be at least a minimum level 2 trained physician, which is probably about 100, 150 hours of training. And level 3, level 4 are your experts, which are a lot of the other physicians that are in the network as well.
Well, and we're talking about stem cell and stem cell therapies, and there are so many clinics now that are offering this. How do you know which one is legitimate or which one is right for you?
Yeah, and that's the difficult part. At this point, the only thing that we can provide to help patients out there to understand what is appropriate is to look at the research that's available. Right now, all the research in orthopedic literature that discusses stem cells or types of stem cells says that bone marrow stem cells are more superior to other forms of stem cells or other forms of tissue products that patients are provided, such as amniotic or umbilical cord. As of right now, those don't show any cells whatsoever that are living. So all you're getting are growth factors out of those and maybe tissues that are dead.
Yeah, what does that mean? We want the living stem cells. Those are the ones that are the most able to help with your pain?
Correct. So think about it. If you have a living cell and you put it back in your body, you're especially hoping that that's going to become the type of tissue that you're trying to heal. Whereas these cells that are being used from amniotic and umbilical cord are dead cells, and in theory, if there were living cells, they would eventually die as well because they're not your tissue. They're someone else's body's tissue.
Are patients asking these questions, or do they know to ask these questions?
Some do and some don't. Some get caught up in the idea of stem cells and then end up in a clinic where they don't provide the best care or provide the best explanation for their care, and then they get caught up in that, and then they end up finding us, and then we re-educate them, which helps them to understand. Unfortunately, a lot of times they have a lot of money spent out of their pocket because of the...
It's already gone. Mm-hmm. What makes Regenexx treatments better than any other?
So the reason is that we put a lot of money and research into actually making sure this procedure works and continuously innovate on it. So as of right now, we spend several $100,000s just on a research lab that actually makes sure that the FDA understands what we're doing is correct, and making sure that when we innovate, that we're innovating appropriately, and then those treatments that don't seem to work out, that we also tell those out there to our network affiliates that we should not be doing these types of treatments, or we should at least educate the patients about what they are going to expect from these treatments.
Bottom line, what you're doing is giving hope to people suffering from pain. And hopefully you can do this without surgery. You don't have to turn to surgery.
That's correct. And most of the time we're able to do that. There are times where we can't. I mean, there are times patients are not candidates for this procedure. And unfortunately, some of these clinics that they go to that are not Regenexx networks will tell them that they're candidates when they're really not. And I've had to turn away patients that said, I'm sorry, but this may not work for you. Or you may need to do this very regularly before we get some good outcomes for you, which takes a lot of time and money out of their pocket.
Well, I appreciate that you want our viewers to be educated and knowledgeable before you do a procedure like this. If you want more information, everybody, you can contact Dr. Khan. He is at Wasatch Pain Solutions. We're going to put all that information on your screen as well as our website, goodforutah.com/GTU. There it is right there. Call and see what the most advanced stem cell procedures can do for your pain. A common area that you treat, a common area that you're helping is where, Dr. Khan?
Spine, back pain, knee pain, hip pain, shoulder pain, ankles, wrists. I mean, we do most of the joints in the body. So it's pretty common area.
Go in and see if this is right for you, if you're suffering. Dr. Khan, thank you for
Thank you.
joining us. We're
Appreciate
turning
it.
to the kitchen next, Brian. If you can't decide what to have for dinner,